Hi, I'm Maya Power, and I have chosen to talk about how minors should be required to obtain the consent of their parents when seeking an abortion. As of 2024, 36 out of 50 states required parental involvement in a minor's decision if they did want to have an abortion. I did want to add that 6 of the states, they've addressed this through a compromise policy. Sorry, I'm bad at recording myself. Which requires parental notification rather than consent, which basically entails that as long as the legal guardian or parent is aware that the child is having the abortion, that's all that needs to be done. I think that is a great compromise that I think a lot of states should implement because, it kind of goes in the exact middle of what people want. In the United States healthcare systems, when someone is under the age of 18, their medical records and healthcare decisions typically fall under the responsibility of their legal guardians. Which, like I said, kind of goes into the compromise that some of the states have made where the parents just need to get notified. Because if they do get notified, then they can still be a part of the process and they can still help out even if they didn't give consent. I do believe that whatever the age of consent is in your state, that should be the age that you can be to make your own decisions if you want an abortion. So, for example, if you live in a state where the age of consent is 16, then when you're 16, you can legally get an abortion without letting your parents know. But if you live in a state where the age of consent is 17 or 18, then if you want an abortion before then, your parents have to know. Access to safe legal abortion care requires careful medical oversight, and parental involvement can help ensure that minors receive appropriate medical care and emotional support throughout the process. Abortion is a very difficult topic that a lot of people struggle to get on terms with. That's why it's such a big problem in our country and everywhere, really. And it's emotional and it's hard and it's happening to a young woman who's going through puberty and they're going through all of this hormones, and on top of that, they're pregnant and scared. They hear all of these things about how teenage pregnancies carry significant health risks, including increased chances of premature birth and any pregnancy-related complications. The mortality rate of pregnant women in the US is very high, and knowing that statistic can be really scary and very overwhelming and a powerful thing that you can't shake off. The World Health Organization says around 45% of abortions are unsafe due to performing them illegally or not taking the proper steps post-procedure. While abortion procedures have their risks, some kids might view abortion as a simple solution to their problems, which kind of goes back into what I was talking about earlier about the emotional support throughout the process. Some kids are very uneducated on the subject and think that, I can just take this pill, the baby will go away, it's not my problem anymore, but they don't understand the traumatic feeling that you get. According to the Guttmacher Institute, pardon me if I'm saying that incorrectly, underage children who had abortion procedures without any help or any support showed signs of PTSD and immense grief lasting an average of 3 years. Having adult support and guidance during this challenging, horrible, traumatic time is very important. Parents will be able to talk to the healthcare providers and understand the medical risks and aftercare requirements. They can help monitor for any complications. I know me personally, I need to have my mom or a friend or somebody come with me when I'm getting a medical procedure done because it's overwhelming and it's scary and you don't know what's going to happen and you're worried and all of this, and that overwhelms you, and it's really hard to pay attention to what the doctor says sometimes, at least from my experience. These days, depending on the state, many insurance plans do not cover the cost of an abortion. Any before care, after care, the abortion itself doesn't cover any of that. When you're a full-time student in middle school or high school, which is the group of children that we're talking about, you probably don't have a job. You can't get a job until you're 16, and so that leaves a bunch of space where you're not employed and you're not getting an income. Anusha Ravi, who's a journalist for the US health insurance system, wrote, "The Trump administration is currently threatening to cut out Medicaid, which leads to defunding Planned Parenthood." And if you didn't know, around 2.5 million patients nationwide, so the entirety of the US, receive reproductive health services. I was talking about how there was a compromise going on, about how the parents just needed to, be aware of what was going on. I thought that was a great thing that should be implemented in a lot more areas. And I think that it's really interesting how, while I was doing my research, like I was talking about, the idea that whatever the age of consent is in the state that you're in is the age that you can get an abortion without your parents knowing. I feel like that would help ease the tension and, make people more at ease on the subject, I guess. With all of that said, and all of that up in the air, minors should be required to obtain parental consent for an abortion. While it's important to acknowledge the maturity of many teens and their abilities to make informed decisions, the need for parental involvement in abortion decisions is also crucial for ensuring support. Like I was talking about, it's a traumatic experience, you're going through a lot, you're going through puberty, all that good stuff. This will make sure that minors have the necessary care, guidance, and protection. So yeah, that's all I have. Thank you.